There's a problem that occurs daily in the United States. Every day, about 40,000 people, there's reports that there is a medical error in the United States. Medical error is defined as a preventable act of care that causes harm to the patient. Medical errors can occur in a various amount of ways. Whether the mistake is through a wrong medication, the wrong patient, a surgical mistake, a wrong blood transfusion, not turning a patient every 2 hours and causing bed sores, or anything else negative that can occur to a patient. There has to be a change for the sake of our patients. According to a survey of physicians and teaching hospitals, it is very important to report every single medical error. This will help to create a culture of learning and help people to learn from their mistakes and thus causing less errors on a daily basis. They say that many errors occur with the inexperienced medical personnel, but it still can occur with someone who has been practicing for years. Research shows that hospitals are attempting to come up with ideas and researching ways to have less medical error in their practices. This can be from something as simple as a charting error into an error that is so heinous that it's fatal. Looking at the errors and classifying them and looking at the causes is the first step. The Joint Commission's National Patient Safety Goals are looked at every year and were implemented in 2013 due to the number of medical errors across the United States. The Joint Commission is the United States' largest healthcare accreditation organization. Based on the types and numbers of the events that occurred, the Joint Commission created a list of goals and regulations that healthcare centers have to abide by. The first is to use at least 2 patient identifiers. This will help to prevent wrong patient errors from occurring. According to the Joint Commission, there are 2 things that have to be done to meet this requirement. The first is to identify the individual to be receiving the intended care, treatment, or services. This other is to match the treatment, services, and other things to that same person. That way it's a double check. The second requirement by the Joint Commission is to have a timely report of critical results of tests and diagnostic procedures. If a healthcare professional looks at these results, they need to be able to perform medical care if needed for the patient, and they also need to be able to communicate these results. This is important because in order for a patient to receive the correct treatment in regard to the results need to be taken and read correctly and passed along to the right healthcare professional. A third requirement is to label all medication in medication containers. This will help to give the right patients the right medication. If there is medication that is transferred into a different container that is unlabeled, there is room for some major medical error. It is always important to label every single medication container no matter what. Many medications have pre-made labels, which makes it easy to add more personal patient information to those bottles. Another goal is to reduce healthcare acquired infections. This is the infections that people require in a hospital that have nothing to do with the diagnosis they have received. They got them from the hospital. Getting rid of these healthcare acquired infections will help get rid of adverse reactions in our patients. The Joint Commission has addressed 4 different specific problems with healthcare acquired infections with a goal for each. They are, the first is reducing central line bloodstream infections. This can be helped by cleaning and other precautions while changing out the wires and administering medications. The second would be to reduce surgical line infections, which would also be helped by cleaning and carefully using sterile precautions when changing wound dressings. The next would be help with the multi-drug resistant organisms, which that would help by really looking at the medication each patient is receiving and deciding whether this is a good one to give to each patient. The last is reducing catheter-associated urinary tract infections. Many people, when they have catheters in the hospital, they are at a very high risk of getting an infection due to the care of the catheter when it is in and the person putting it in. So the protocol is to take it out as soon as possible, not have it in as long. So to help reduce it, there's many ways you have to help clean the catheter and keep it intact on the leg. In conclusion, if the healthcare industry can simply take a step back and look at the medical errors that occur every day in the United States, across the United States, and also look at what it does to our patients, how many deaths it occurs, how many wounds, how many injuries, and how it just affects the way healthcare looks in the United States. If they can look at these and make changes, make new rules, make protocol for the hospitals, and really teach their personnel, that this could really make a big change in how the healthcare in the United States is perceived and how patients and citizens look at health professionals in the United States and different hospitals. Thank you.